I mean, I think we need to probably reflect on how the global architecture can be improved. I mean, there could have been more global perspective towards many aspects of how the world has responded to this pandemic. And I think that's partly down to individual countries to decide, do they want to commit to such multilateralism? Partly we do need to rethink a little bit the governance of organizations such as WHO. One of the challenges it faces is being truly independent. I mean, typically it is influenced by big states. Historically, that's been Western countries, the United States, now very much China as well. And that can sometimes prove challenging in situations like the last year.
This crisis, compared to many of the crises in at least the last decades, have become a lot more politicized than before. And I think that has made WHO role a lot more difficult than it has been. And they have been forced to sort of handle this political spectrum at the same time as handling the technical one. And I think that really had put challenges on them that's not been completely easy to handle. On the other hand, I and Sweden definitely are we really believe that WHO is hugely important, but I think there can be improvements after this, and I think we're going to have those discussions again. What exactly will be the WHO role in this?
I just looked at the last map of countries where vaccines have been given already. Looking at it from a global perspective is heartbreaking. But it's early days, it's January. We'll have to see how the year pans out and whether we will look back to this year as a year in which we take pride in as global citizens in terms of access to vaccines, or a year where we will look back and wonder, gosh, the divisions of the 50s and 60s and 70s are still there, and they're just defined by different means.